Welcome back to the In the Clinic podcast with Rob. And if you're looking to avoid common mistakes to heal your knee pain in under 2 weeks, then this is the podcast for you. So today we're really hammering into knee pain and how to get rid of it as quick as possible. So again, I'm Rob Sumner. For those of you who don't know me, I own Sumner Specialized Physical Therapy and Specialized Strength. And I really just do these videos because there's a lot of people in pain out there, and I really don't want you to be one of them. And I really want to improve your life in any way that I can, whether it be fitness, physical therapy, nutrition, mental, psychological, mindset, whatever it takes. I just want to help you in your life. So hopefully there's one person out there that enjoys this video today and gets some value out of it. So at this point, let's kind of dovetail forward and get into common mistakes that people make that don't really allow your knee pain to heal. So this really takes a full circle because this is a personal story about myself where I started to develop inner knee pain, inner meaning on the inside portion of it. So what anatomically it's medial. So it's along the inside part of my knee, right in the joint line, and I was developing pain, and I was playing a lot of basketball. I was enjoying playing basketball. I was playing 2 to 3 times a week, and it was starting to really impact my ability to play. I couldn't run as fast, I couldn't cut, I couldn't jump, I couldn't do the things I wanted to, and it was right on that joint line. So, I was a physical therapist, still am, and I was younger in my career, and I wasn't really sure. It felt like it could be a meniscus, it might be my medial collateral ligament. And so as I dovetailed through it, I realized that, I think this is a medial collateral ligament injury. And through that process, I kept trying to do things that would make it better over and over and over. But randomly, I couldn't pinpoint it why I was consistently getting more pain. Some days it was really flared up. Some days it was pretty mild. And I couldn't really isolate when it was giving me a problem. So after our talk today, you should have a clue on why my knee pain wasn't getting better. But let's dovetail into this because what we're going to hit home on is the medial collateral ligament. So that's funky jargon, medical term for essentially a ligament, which is a piece of tissue, a firm piece of tissue that connects bone to bone. And that ligament is on the inside part of the knee by the joint line. And its real function is to prevent the knee from really pushing inward. So when you cut and turn and twist and you take a quick change of direction, that medial collateral ligament really helps to keep your knee at bay. It really keeps it in a firm position. So it's a really dense, fibrous tissue that allows the knee overall to have stability. And that's the purpose of a ligament. It provides stability from bone to bone. So when testing my knee, it wasn't lax. It wasn't like the whole collateral ligament was torn. It was still firm. So why was I getting pain over and over and over? I was really irritated. So when we're looking at the medial collateral ligament, I started to dive deeper into my education on really what it is and what happens. And in one of my orthopedic books that talked about the medial collateral ligament, I found a section that talked about how the medial collateral ligament is a primary restraint for the inside part of the knee in a valgus position, meaning that it pushes inward, prevents the knee from going inward. But then I kept reading, and it said that the ligament also becomes under tension in hyperextension and hyperflexion. So as the knee hyperflexes, it goes all the way, and the condyles on the end where the knee joint opens up actually separate and put that MCL under strain. And when the knee's in hyperextension, it puts anatomically in a position where the ligament becomes tight again. And that, ladies and gentlemen, is where the light bulb turned on. That right there is where the light bulb really turned on. And I went, whoa, that makes sense now. And through that understanding of the anatomical position and function of the medial collateral ligament, I now present to you 5 easy, common mistakes that people make that do not allow your knee to heal under 2 weeks. So follow these tips, Rob-approved tips, and it will prevent your knee from lingering and lingering and lingering. So, medial collateral ligament, here we go. Number 1, do not fully squat. Now, you can squat, but don't squat to where your heels touch your butt. Because when your heels go all the way down and touch your butt, do you know what happens? That medial collateral ligament is now under tension, which causes irritation, which makes your pain linger. So don't fully squat. Number 2, and this is a hard one to conceptualize, but I see it all the time. Don't hang your leg off a coffee table. So picture yourself sitting on the sofa, you're laying there, and you take your leg and you lift it up on the edge of the coffee table so your heel is resting on the edge of the coffee table. Well, that resting on the edge is now creating a hyperextension force that goes down on your knee. Well, what did we learn? That the ligament comes under tension and hyperextension. Bingo. Hey, I'm resting. I'm not doing anything. I'm just sitting here on the side of the couch. I haven't been playing basketball. I'm not jogging. I'm not doing anything. And my knee pain won't go away. And that's because while I'm sitting there watching football and hanging out at night, folding laundry, I'm resting my leg, my heel on the coffee table, which is causing hyperextension, which is causing strain and won't let it to heal. Ha! Let's go back to number 1. Don't fully squat. What was I doing at the time? I was coaching softball. I was squatting down all the time and catching pitchers. Whew, I was doing the first 2. Number 3, don't take long walks or a bunch of stair stepping. Put strain on it again. Number 3. Number 4, don't let your butt touch your heels ever. And where this goes to number 1 with don't fully squat, but think of when you're kneeling, gardening, and you rest your butt back on your heels. That puts that MCL under strain right there. So again, that's number 4. Don't rest your heels on your butt. And number 5, my 5th common mistake to avoid to let your knee pain heal under 2 weeks is don't plant and twist. I'm still trying to play basketball. Plant, cut, twist. That puts that MCL under strain. So definitely 3 out of the 5 I was doing, and my knee pain kept lingering and lingering and lingering. And once it was like a kaboom, and I increased the knowledge in my brain of understanding of what the medial collateral ligament does, and I started to apply these tips, guess what happened to my knee pain? Yep, it went away. And how quick? Under 2 weeks. Complete turnaround, complete difference. And even though that I was resting, wasn't doing all the things that I thought I needed to avoid, I was still getting pain. And that's because I didn't fully have an understanding of really what was causing my pain generator. And I'll circle the wagon on this and talk about a lot of my patients. Because what do we see with a lot of the patients? They don't know why their pain is flaring up. They don't know why it's consistently being a problem. They don't know why it's continuing to irritate the joint or whatever is bothering them. And the reason it's continuing to bother them is because they can't recognize the pain generator. So the great value of having an individual like myself, a provider like myself, or the other colleagues that are in our office, they've seen it all. They've seen over and over and over people that have come in with this exact same injuries, and they know what's really causing a pain generator. So here I was, as a physical therapist, a young physical therapist. I've worked with individuals with MCL sprains before, But I didn't have a full concept of the anatomical position of the MCL until I was having problems myself and I had to dive deeper into it. So even if you're out there and you're thinking, hey, I've got this knee pain, all I need to do is rest and it's going to go away. And then it doesn't. And you're left going, I don't know what to do. I'm not sure if resting is helping or if something else is hurting. If you're sitting there wondering, you're probably right. You are probably right that you're doing something that you're not fully aware of, that's not causing pain in the moment, that's exacerbating your symptoms, that's preventing you from really getting this injury taken care of. And what does it really mean? You get it taken care of, then you can live your life the way you want to. I return to basketball, catching softball, doing all the things that I enjoy. So what are you missing? What are you missing in your life that's not allowing you to fully enjoy your life because you could be flaring it up and you don't even know? So don't delay. Take the time now. Message me on this. If you're watching this on YouTube, you can put a comment in there. If you are listening to the podcast, you can leave a comment there as well. Or you can find me on any of my socials from Rob Sumner to Sumner Specialized Physical Therapy. Send me a message. Let me know that you listened to this podcast on medial collateral ligament pain. And just tell me that, you know what? You're not sure why your injury's not healing. And I'd love to take a look at it or give you my thoughts or even arrange what we call a discovery visit to help. So overall, hopefully you got a lot of value out of that today and understanding that just because you're getting pain, it's continuing to hurting, that there is still hope for you, that even if you've had it for 2-3 months like I did, that there's still hope that you can get it better and that there is an intervention out there that will allow you to live your life again. And it could be something as simple as just changing the way that you live your life temporarily to allow that tissue to heal. So overall, team, I appreciate you listening today. If you listen to the full podcast, thank you. Love you forever. Hit subscribe and leave a comment. That I would love both of those on YouTube. If you're listening to this on Apple Podcasts or Spotify or any of those, definitely subscribe and give me some type of acknowledgement there with a like or a comment or other. So I love getting in contact with our listeners and our viewers. So fire away. Other than that, I'm out for the day. And again, take care of those knees. I'm out.